Hi, everyone. It's Dr. Paul Romeliotis, Medical Officer of Health Center Health Unit, giving you another update of where we are with COVID this past week, and what we can do to best protect ourselves. So, as usual, I'm going to share my screen, and as you can see here, we've got 8 hospitalizations right now, 1 in the ICU. Our positivity rate has been going up. We can see here that we're now at about 16%. And so it's slowly creeping up. Again, it's a bit lower than the provincial average, but certainly on the uptick. If we look at our number of hospitalizations, basically overall we have about 30 patients hospitalized, but more than half of those are not due to COVID. And in our area, as I said before, we have 8 hospitalized and 1 in the ICU. You can see here as well with the trends again. Going sort of from January down here. So that is, again, we're increasing those numbers, and we're seeing that provincially, but not to the extent that we had in January. You can see here our hospitalizations were really up in January, February with wave 5. But then you could see here that we're going up, but not to the extent that we've gone up there. Again, we need to keep an eye on that. In our total active cases, because has gone down, but we stopped testing a lot, so we can see sort of a slight increase as we move forward in that direction. The other thing that we're looking at again is long-term care and retirement home congregate setting outbreaks, and you could see we're up now to about 15 here, and most of them are in residence, although we see them in staff. One of the things that we noticed here is that most of the residents who are positive are either mildly symptomatic or have no symptoms at all, which is good. And I think it's a testament to their 4th dose that they've already received. We can also see, if we look at our deaths, unfortunately, and we're seeing more and more deaths in the community right now, again, in the older age group, of course, and that's why it's important to get that 4th dose, because it's starting to wane off. We can see that most of our deaths occurred during the 5th wave. That's because we had so many more people infected. It's very, and again, a lot of them had underlying medical conditions, and most of them were over 60, predominantly over 70, and we do know that most of them, in terms of proportion, were not vaccinated versus vaccinated. If we're looking at our wastewater, you can see that this is for Cornwall, Hawkesbury, this is for Cornwall, this is for Castleman. We've had some ups and downs in Castleman, but in all 3, we've kind of leveling off a bit upward tick here. And if we look at that provincially, what we're seeing is basically starting to perhaps see a bit of a peak here. I'm told that the latest statistics show that there might be a peak and a sort of a flattening in east. But we're going to take a look at that over the next couple of days. So we are seeing again, but however, you could see across the province is an upward tick, again, with some areas looking that they might level off. But again, we need to keep a close eye on where that goes. In terms of the number of health units that have increases, most health units have increases. We're kind of in the middle here. And in terms of vaccinations, this is an older vaccine. This is last week's, but we're now over 60% 4th dose, and we're starting to see some people come out for their 3rd dose, and we encourage you, and I will talk a bit about that later. Again, 3rd dose needs to be increased among our 50 and above, particularly 60 and above, but we're now recommending it across the board. It's one of the better ways that we can protect ourselves, and I will talk a bit about that later. I always show this graph because it shows that the 3rd dose protects you for much longer and in higher ways than 2nd doses. And again, this slide here shows that predominantly the deaths occur unfortunately, in the ICU admissions more towards the older populations, and again, you could see the ratio of partially vaccinated to fully vaccinated is quite high. So it's a much higher risk of getting severe disease if one is not vaccinated. Locally, again, we're seeing the same. You could see that in terms of a percentage, almost 70% of our cases were not vaccinated, and 30% were fully vaccinated. So basically we now are in a sixth wave, and so there are some things that we can do to be able to blunt that. And we do believe that it'll take another month or so, 3-4 weeks, for the wave to sort of start going down. In the interim, what we want to do is protect our vulnerable populations. We also want to protect our hospitals from admissions, ICU admissions, and so on. And also, what we want to do is we want to decrease the transmission that we're seeing quite high in our area and across Ontario. That schools are having not a lot of schools. As a matter of fact, only a few schools in our area. I think 2 have had more than 30% absenteeism. But what's going on is that they're having some difficulties if the parents have to stay home from work. So if they happen to be working in a school or happen to work in a healthcare setting, that is something that we're looking at. So we're looking at the degree of disruption. We want to minimize the degree of disruption in the hospital settings by ensuring that there's less transmission, less people sick, less people off, because most people who get it will not be admitted, but if they work at the hospital, they can't go and work. And at the same time, prevent the elderly from getting sick and people who are more vulnerable getting sick and entering the hospital. And that's really our bottom line. So what we need to do that, like we are in the sixth wave, so we can blunt it. It's, again, we need to get vaccinated. Again, third dose, if you haven't had your third dose, we're only at 60% third dose. We need that 40% to come out of 12 plus to get their third dose, because that's going to significantly increase the protection across our area, particularly against Omicron. We also now have a fourth dose for elderly individuals, 60 and over. The recommendation is 5 months, but the older you are, the more underlying medical conditions you have, I would recommend you can get it a bit earlier, say after 3 or 4 months after your third dose. So that's very, very important. And one of the things that I put here, we see here that even if you have had COVID, get vaccinated. We know that COVID, if you get COVID, you'll get a bit of protection, but that wears off. So we need to give you another vaccination 3 months after you've had a COVID infection. That's very important. So then the fourth dose, again, 60 plus First Nations, obviously wear a mask when required, and we recommend it strongly recommended in indoor public settings. And just on a final note, before I talk about this coming weekend, right now we've got antiviral treatments. And that's another thing that we can do that will help decrease the load in the hospitals and prevent severe disease among the vulnerable situations. So right now, we're getting all that organized in our area. We will have on our website and where you can get it if you are under these circumstances. Bottom line is that this is a medication. If it's given within the first couple of days of you developing symptoms of COVID, we can test you, and if you're positive, you get these pills for 5 days, and those pills actually for 10 days, I think it is. But in any case, those pills reduce the treatment, the actual severity of disease and need for hospitalization by 85% at least. So this is good news. Again, another tool that we have to be able to blunt that increase. And so go to our website, EOHU.ca. You'll have the information there about who it would be. Essentially, it's individuals who have weakened immune system, 70 or age or over, 60-year-olds who are not fully vaccinated, and people with underlying medical conditions. And that's all on our website. I just wanted to let you know that, again, in addition to third and fourth dose vaccination, masking, the precautions that we're taking, we also now have the antiviral medications that will help prevent severe disease and death, particularly among the elderly and the vulnerable. And just before I finish, I just wanted to let you know that this coming weekend is a long weekend. It's Easter weekend. A lot of people will be getting together. So don't forget that we're still in the pandemic, and there are some things you can do to slow the spread. Like I said, hand washing, wearing a mask, opening a window, airflow, going outside, celebrating outside if it's nice weather. I'm not sure what the weather is going to be. Don't go if you're sick or somebody there is sick. And the more people are vaccinated, the better. So make that as part of your risk assessment, because again, this is a crucial time where we are now with that sixth wave, where we really want to make sure that it just comes and goes quickly without overburdening our hospitals without causing a lot of illness. And again, the best thing we could do, and I repeat again, for people who have not got their third dose, please go and get your third dose. And for individuals who are due for their fourth dose, particularly those specifically those 60 and above, please go and get your fourth dose. That will increase our ability to fend off and blunt this wave that we're in. And because we do suspect that, within 3 or 4 weeks, it'll get better. And we are looking forward to having a more normal summer as compared to previous years. So thank you very much. Have a nice long weekend, and I'll talk to you next week.